first of all, fantastic meeting, right? A lot of key opinion leaders and fantastic discussion. I love, especially the discussion around the bladder cancer. What a thoughtful way of analyzing the data. There's a lot happened in the last month or so with new data being presented at ESMO. I mean, everybody's highlighting the EV302, the combination of infliximab vedotin with pembrolizumab for patients with advanced urothelial carcinoma. But actually the discussion around that, but also around the combination of immunotherapy plus platinum, potential differences between cisplatin and carboplatin, who perhaps won't be offered infliximab pembro, EV pembro, who might still be considered for nivo platin or cisplatin combo, or even maintenance of avelumab. I mean, it was such a thoughtful sequence of important points that are trying to make sense out of the way we, how we manage patients with advanced urothelial carcinoma today. That is very different from our thoughts perhaps a month or 2 or 3 ago, right? So to me, that was very, very impactful, and I loved it. So your question is, whether or not the combination of nivolumab to the backbone gemcitabine and cisplatin combination, being the only positive study that investigated a combination of immunotherapy, PD-1 inhibitor with chemo, is that, because it was the only one to show a survival advantage compared to the other studies. We did that with atezolizumab, we did that with pembrolizumab, right? And, thus far we had the only IO approved in the front line with survival advantage was avelumab maintenance. So I think there's, as rightful, so, the fact that, these patients were cisplatin eligible, that is a big difference, right? The other studies took patients who were platinum eligible and not necessarily cisplatin eligible. So, and we all agree that, cisplatin and carboplatin are not exactly the same. And, I think it's fair to say that definitely patients, cisplatin is better, superior to carboplatin. So I think it's almost like, I think it was Matt who brought it up, I think it's a fantastic point. It's almost like we created the hypothesis in the prior studies because we do see perhaps a potentially additional benefit in the cisplatin group, and that was confirmed prospectively, in this large phase 3 trial, combining nivolumab to gemcis. So from that perspective, I don't think it was out of nowhere. I think it was like, it confirmed the hypothesis that some had, and, but you always like to confirm that. And by the way, that would be the highlight of an international meeting if you didn't have infliximab vedotin pembro as the first combo to surpass, by far the activity of a platinum-containing regimen. Like everybody would be talking about nivo cisgem, and the reason why we're not talking about it as much is because we actually got the wow moment, standing ovation, when we saw that actually patients treated up front with infliximab vedotin, had these outstanding, remarkable results, can potentially lead to long remissions for a group of patients. We don't know if it's 30%, 40%, perhaps we'll see. We need longer follow-up, but that is completely outstanding. So I don't think it came out of the blue. I think it changed the narrative thus far, and it brought up again the concept of concomitant is offered up front versus waiting for patients who have not progressed on chemotherapy to embark on IO with avelumab. So I think that's novel by itself, because the first time we saw that. But I think we paid a little bit less attention because of what happened with the alternative combination, who turned out to be superior.